There we go. Okay.
Sorry. And I guess we will send the first QR code for the.
Is it up next?
No, is that not yet?
No, then we'll wait till it
Okay,
comes up.
sounds good. So, so as I was mentioning, last year they decided to include some questions about sexual orientation and gender identification. And that's kind of like to have more access to services that that community needs. Is not required to answer those questions. It's not that people are going to penalize because they don't answer those questions. It's just like we try to encourage to advocate more for services on the LGBTQ community. So that's how it started. And those are the three questions that I put there. Is the sex assigned at birth, the gender identity, and the sexual orientation at the moment of the application. So those questions are just to report demographics. As I mentioned, it is not a requirement to get financial assistance. It's more like we need to know what are the issues so we can advocate for those issues. At this time, any data that is being receiving through the marketplace is not shared and is not sharing like with Medicaid or any other agencies. So it's being secure under the ACA regulations. And this is the most excited as a Latina. I've been doing this for a lot of years and have been advocating for this rule specifically to pass for the past 10 years. Is so excited that finally we are going to have the DACA rule. If you were present at the presentation last year, that was kind of like the proposal. So we finally got it together, and the Congress and the Senate and this administration finally passed a rule. And now every DACA recipient is now eligible to get marketplace access, but also they will get financial assistance. If you have been volunteering under the Navigator program in the past years, or if you are new to the Navigator, until this year, actually until November 1st this year, any DACA recipients, even though they have a status, a legal present status in the United States, they were not eligible to get marketplace, Medicaid, or anything for access to healthcare, not even like buying privately. The only way that they were able to get health insurance was through an employer sponsorship. So we are so excited because right now we are going through our database from our office that they did DACA applications back in the day, and we are calling them to announce the good news that they are now going to be eligible to get access to healthcare and to get marketplace. Unfortunately, this rule will not apply for Medicaid. It will only apply for federal programs, not for the state program. But at least they will have something. They also have to follow the other eligibility rules like the income and the household size and all that. But we are still excited to get the coverage. So what this rule means is that so there are like two parts of these rules. So one is that now DACA recipients with the DACA status on their employment authorization cards, they will be eligible to enroll on a marketplace plan, but also they are gonna be eligible for a special enrollment period starting in November. So that means that as early as December 1st, they will be covered. And that's so important, and that's why we need volunteers to help us reach out to all those members in the community that needs to schedule an appointment with a navigator, that needs the assistance to walk through the application and walk through the questions. And also, there's a huge important factor here that if people below 100% that have a legal status or a legally present status in the United States, that now they are also going to be eligible for getting the immigration exemption through the marketplace, so they will be able to sign up. Remember that to get financial assistance, you have to be below, like from 100% to 400%. So immigrants with a legal present status, even though they fall under 100% of the FPL, the low income, they will be able to get financial assistance through the marketplace through the immigration exemption. Another changes are about the lawfully present rules. So in the past, anyone that was here in the United States with a type of visa, we have to check that category to make sure that they were eligible to get marketplace or to get any type of health access. So additionally to the DACA rule, there are like a few groups of people with a special visa that were not eligible until November 1st of this year. And those are like the non-citizens with work authorization. And those means like they had an employment authorization card, but the category were a different category eligible for getting marketplace. So now everyone, even though they just apply for the employment authorization card and they have that receipt that shows that they apply for the employment authorization card, they will be eligible to enroll on a marketplace plan. The second part is the family unity beneficiaries. That means like we have a lot of like works visas that people maybe bring their spouses and their family unit, but unfortunately they have like a different category that were not eligible to get marketplace. Now they're gonna be able to get marketplace as soon as they submit the application and with the receipt. They are not waiting until they get a green card or until they adjust their status. They can now, with the family unity beneficiary, they will be eligible to get marketplace. The third one is the applicants of a legal permanent resident status or an applicant for a green card. Those are usually like people that are just adjusting their status through a different program, or maybe they have a family that petitioned them, but they are in that process through marriage. Like there's like a different ways to adjust your status and get a green card. So in the past, everyone has to wait for the green card or have to wait for the employment authorization card in order to apply for marketplace. Now, just with the application received, now they are going to be eligible to get marketplace. So that's a huge success and a really good rule this year, because if you are familiarized with the immigration process right now, they are so backed up since COVID that sometimes those processes last for like 2 years, 3 years, that used to be like 6 months. So we are grateful to have that new rule and to be able to have people enrolling on marketplace starting this year in November 1st. The fourth one is the removal of the 180-day waiting period, and that's for like children. As I mentioned it, we used to wait at least 180 days for children to apply for marketplace. And that means like they will get like an employment authorization card or like some type of document that will make them eligible. But now we don't have to wait those 180 days. So children, especially like younger, that needs like vaccination and continuously checkups, they will be eligible to get a marketplace plan. I want to emphasize that all these changes, even though it's from the federal rule, is only applying for marketplace. Nothing on the statewide plans are changing. So this is only for marketplace coverage. And the last one is the special immigrant juvenile status. So right now, actually, somewhere in another firm, they are having their CLE. For those unaccompanied minors that are applying for the SIGS status or the Special Immigrant Juvenile Children status. And those are also like a category that had to wait a longer period of time to be able to enroll on a marketplace. Now with their application, we are going to be able to enroll them.
And with that, this is the first CLE code. So anyone who is seeking CLE, again, you're going to scan this QR code. Do not submit yet because there's going to be a second code at the end, but the first code is Troutman 20. Troutman 20, you will put that in the first CLE code box. And again, do not submit yet. Hold off until you get that second code.
Okay, hi. So my name is Rosie David. I'm going to talk to you about Medicaid a little bit and changes. So Medicaid in North Carolina has become the 45th state to expand Medicaid in our country. That includes DC. More than 600,000 adults are now eligible for Medicaid under expansion. In North Carolina, Medicaid currently covers 1 in 9 adults ages 19 to 64, 2 in 5 children, 5 in 8 nursing home residents, 1 in 6 Medicare beneficiaries, 3 in 10 people with disabilities, and 39% of all births. Currently, 2,978,559 people are enrolled in Medicaid in our state. Medicaid in North Carolina. So Medicaid is a federal and state-funded health insurance program that provides health insurance coverage for some of the most vulnerable low-income North Carolinians. Medicaid improves access to health care and improves health outcomes for North Carolinians. Medicaid increases access to primary care providers, regular checkups, preventive care, and care for chronic conditions for low-income residents. Medicaid coverage also reduces medical debt for low-income households, which helps people have access to better credit. As of July 2024, 2.9 million people in North Carolina have full Medicaid coverage. That means they are not paying anything out of pocket for healthcare. So general income eligibility for Medicaid. As Natalie was talking before about the federal poverty line, it's currently set in 2024 at about $15,000 a year for a household of 1, $20,000 a year or so for a household of 2, just under $26,000 for a household of 3, and about $31,000 for a household of 4. Just to give you an idea of what that actually means, right? Income is calculated differently based on category of eligibility. The income limit, for example, for Medicaid for the aged, blind, and disabled is set at 100% of the FPL. Other categories are a little higher. For example, pregnant women, it's set at 196%. And for children ages 0 to 18, it's set at 211%. Other categories are lower, such as 46% for parents and caregivers of children under 18 and children 19 to 20. So what changed since last year? It was huge for us. We heard the words Medicaid expansion over and over. It seemed like this thing that was far away. And then last year it happened. On March 27th of 2023, Governor Roy Cooper signed Medicaid expansion into law. North Carolina, as I said, is the 41st state to expand Medicaid. Since the implementation, more than 500,000 people have enrolled. It was implemented this year. When was it? May?
No, December 1st.
December 1st, I'm sorry. So it's now September, and we've enrolled more than 500,000 people just in North Carolina. So who will be able to get Medicaid in North Carolina? Most people can get healthcare coverage through NC Medicaid if they meet the criteria below. If you were eligible before, you remain eligible. The eligibility criteria are that you are a resident of North Carolina, that you're aged 19 through 64, that you are a citizen. Some non-US citizens can get coverage through Medicaid, but we'll explain a little later. And then if your household fits within the income chart. So that is monthly numbers before I'd given you yearly amounts. I'll leave it up for a second so everyone can see the amounts. All right, so we are a determination state on the federally facilitated marketplace. In March of 2024, North Carolina became a federally facilitated marketplace determination state, meaning that North Carolina residents are determined to be eligible on the FFM will not require processing by a Medicaid worker. That simply means that you can sign up for Medicaid on the healthcare.gov website. It's a great idea in theory. It's still a pretty new program. I can tell you as a navigator, there are certain hiccups that have made it difficult. For example, we've had many mixed status households where the parents might not be eligible, might not even have, residency status in the United States. Children are eligible, and then we have to go through the Medicaid ePass website anyway. It has ushered in an unprecedented level of broker fraud, unfortunately, which we can move on to talk about right now. So what is agent and broker fraud? Enrollment in a marketplace health plan by another person, such as an insurance agent or broker, without the consumer's consent and knowledge. A change in the consumer's health plan enrollment initiated by another person, such as an insurance agent or broker, without the consumer's consent and knowledge. We've had clients, for example, who have had 1 month, they get their cards with the Blue Cross Blue Shield plan, just for example, and 2 months later they get Aetna cards, and 2 months later they get United Healthcare, and they'll call us and be like, what is going on? I didn't apply for any of these ever. So somebody has logged in to the federally facilitated marketplace, used their information, and committed fraud. An enrollment in a health plan in the marketplace because of misrepresentation of a consumer situation by an agent or broker for purposes of making an ineligible consumer eligible for marketplace coverage. We've had clients who are ineligible due to immigration status or due to income get enrolled anyway. Or we've had clients who were already approved for Medicaid still get enrolled in marketplace plan. So on July 19th of 2024, thankfully, the Biden administration put in place stringent curbs aimed at thwarting rogue insurance brokers from switching consumers' ACA plans without their consent. CMS will block agents and brokers from making changes to a consumer's FFM enrollment unless the agent is already associated with the consumer's enrollment. So if they were initially helping them and they gave their insurance broker number, they have explicit concern in the marketplace from the client, they can do it. Otherwise, not happening. So they could be suspended or they could be terminating agents and brokers who perform unauthorized marketplace activity. The Centers for Medicare and Medicaid Services posted that in the first 6 months of 2024, more than 200,000 people reported to the agency that they were either enrolled in Obamacare plans or switched from one plan to another without their permission. So we've got a few best practices for handling marketplace agent fraud, broker fraud. The first thing you need to do is you call the Health Insurance Marketplace Center, the call center, the number is up there. You find out the status of your enrollment. You may owe a repayment to the IRS if you received a premium tax credit that you weren't eligible for. Number two, if the marketplace reports that you did not have coverage in 2023 and or 2024, there's nothing else to do. If the marketplace confirms that you did have coverage, you report the enrollment without consent and submit an agent fraud claim so that your coverage can be terminated. The marketplace will then investigate your claim. At the end of the investigation, they'll let you know via letter the fraud resolution. It takes 30 days or longer. Fourth thing you should do is contact a health insurance navigator to report fraud to the Center for Medicaid and Medicare and to submit an agent fraud claim with them so that your coverage can be terminated retroactively. This would allow you to cancel your entire coverage from the original issue date. Residents of Mecklenburg, Cabarrus, and Union counties, please call our offices, 980-256-3782. North Carolina residents in all other counties, call 855-733-3711. If you've been enrolled in one of these plans, you may receive an amended 1095 tax form. Charlotte Center for Legal Advocacy Low Income Taxpayer Clinic may be able to answer questions regarding your 1095A form, and the number is listed below. This is you again.
Yeah. So just going back a little bit about the fraud cases, some of the reasons why we need volunteers like yourselves is we have an increased amount of people that are being signed up without their knowledge, but also, as Rosie mentioned it, they are signing up like several times on the marketplace. We have cases with 7 open active accounts right now. We are doing a lot of advocacy, but as you can imagine, this takes time. And that's the time that will kind of like prevent it to us to call our clients to schedule appointments, to follow up with clients to make sure that they will show up for that appointment. So that's why we need you during open enrollment. And that's my call to take action. So this year, if you have been a volunteer in the past, we usually have like 2 types of volunteers for our program. One was as an enrollment volunteer and another one was as an outreach volunteer. This year we decided to get out of the volunteer for enrollment, since that takes a lot of your time, a lot of training, and it's a lengthy process to get certified, to pass background checks and all that. So this year we are gonna make it simpler for you. So you will be able to help us reach out the majority of our community. So this year we only gonna have volunteers, outreach volunteers. What that means, that you understand health insurance options. So you basically just had a crash course on access to healthcare in North Carolina. But we are going to continue doing your training. But we also are, so you're going to do a training that we're going to offer. We need someone with communication skills, computer skills, confidentiality agreements, time commitment, and cultural competence. As you know, healthcare access in North Carolina is for very vulnerable, low-income families, and we need to have like that culture and community competency. So the responsibilities for these volunteers through the open enrollment is a very short period of time. Is other CLEs that are going right now in other places in Charlotte that you have to commit for a whole year. We only are going to ask you for 2.5 months. Sounds awesome, right? And it's going to be from your, like the comfortable of your house, office, even your vacation home. So you're going to make calls. We can provide the whole database with previous navigators. So what we usually do from October 1st to November, or at least until like December, is to make sure that everyone that we serve in the past is being taken care of during the open enrollment. So we are going to provide a whole database of numbers and consumers that we already helped out. So you can schedule an appointment for a navigator for that client. You also going to provide like general information. We are not asking you to know every single plan. That's why the navigators are getting paid off. So you just have to provide like some general information, the same way that I just did today and Rosie did about Medicaid, and just sign them up with a navigator. They will be able to help and to answer all those very particular questions. And then we are going to ask you to report and schedule. So this year, our pro bono coordinator is creating an amazing app and a website that will be able to help you through the whole process. And we are just going to ask you to report those information on that database. So the navigators will have that information on hand and will provide the best service available. So, are you ready to help us? Sign up now. So everyone has a smartphone. So I'm just going to ask you to just scan that QR code and you will be able to sign up as a volunteer, outreach volunteer for the navigator. Let me know if it's not working, but I hope it works. Yeah, okay. So I'm going to give you a couple of minutes so you can fill it out, those forms. I'm not asking much, just your form and some type of email or communication that I can send you out the invitation for the training. And remember that we have hundreds of DACA recipients that we need to call. So that's why we need you more than ever. Ready? And then this is just the save the date. So on October 1st, we are gonna share like a link through Zoom at 3 p.m. Just to go through the app and the website that I just mentioned. We are gonna just walk through how to schedule an appointment with a navigator. We have a platform for our scheduling system that is called the Connector. So we're gonna show you how to do that, how to work on the script and all that. So it's easy peasy. And you will get your hours for pro bono. So I think the last, and that's it. Any questions right now? Come on, don't be shy. You can ask.
I do have a question. The agent broker frauds, I guess, do the agents and brokers get commissions? Is that what?
Yeah.
So every time that so for the Zoom, if you didn't hear the question, someone here asked about the agent broker fraud. If the agent and brokers kind of like receive a commission when they sign up people, and the answer is yes. So the way that they do it, and that's why some of the plans are like super cheap, so they provide like a little bit more, which is strange, but they provide like more commissions. So that's why they go through the applications of a consumer and lower their income. So that income will fall maybe on a plan that they don't have to pay anything. So the beneficiary will never find out that they were actually enrolled. The other way that they are doing it is they are changing like the address and phone numbers and emails. So they are putting like some random addresses that are like an empty lots or like a whole complex without providing any like unit or an apartment number. So those mails actually never got to the beneficiary. And last year and this year, they are finding out at the time of the tax preparation. So when they are doing their taxes are being rejected because they haven't reconciled all those credits that they received the previous years. So when we call the marketplace, they are saying, oh, yes, they had like 2, 3 programs in 2023 and actually 4 programs in 2024. And they are actually signing up for every single program.
Yeah.
Any other question?
What can volunteers look forward to, like, joining you guys' team?
What do you mean?
I mean, like, what, like, what can I look forward to, like, the work environment, everything like that?
It's from your home, from your office. You don't have to go to CCLA. I mean, you're more than welcome to go to CCLA. But it's actually, we're gonna provide like a phone line. So you can make calls. We are asking for at least 25 calls to be made, depending of the number of volunteers, of course. But also kind of like if you have a commitment to maybe help us like once a week or something like that, we also can provide like a list of the appointments that are being already scheduled, just for you to kind of like remind those people that they have that appointment, and if they have any questions, also like sending like information about like what documents they need to have the day of the appointment, and what information they may need during the appointment, and that's it. Any other question? Nope. Okay. So that's it. This is our contact information. Shaylee is not here with us today, but she's gonna be the volunteer coordinator. So she and I will be talking to, I hope, everyone in this room and on Zoom.
And now we have that final CLE code here. So again, if you are seeking CLE, you will need to put this code in on that survey. Again, the QR code is here in case you've missed it the other 2 times, but it's going to be Triage 24. Triage 24. And then once you have that in there, we do appreciate your feedback. So please feel free to fill out all the different portions of that CLE survey. The most important pieces, I need your name, email address, and your state bar information. I cannot submit to state bars if I do not know which ones you need. So please make sure that I get those. And then again, you need both CLE codes as well. Now, once you have that, you can just hit submit. I do try to get CLE certificates out as quickly as I possibly can. So I will try to get those to you within a week's time. If you do not hear from me by 2 weeks, please reach out. Again, I'm Kaylin Collier with Troutman Pepper. But again, I try to get them out fast, but if you don't hear within 2 weeks, please shoot me an email so I can rectify that. Maybe. There we go. Okay.
And that's it. Thank you so much for attending the CLE, and thank you on Zoom.